Yeah, they do get it. And I want to introduce you to somebody who's just delightful. She's been hanging out in the studio for a couple minutes. So, Dr. Syed, how are you?
I'm doing pretty well.
You are doing good. Well, welcome aboard. So, is this your first time in the radio studio?
Yes, it is.
Are you okay? You didn't run screaming out the door, so.
It's a pretty pleasant, comfortable environment.
So, you practice in internal medicine, and you're part of the Lake Health Physician Group in Willoughby Hills for internal medicine. And we're here to talk about diabetes today because, man, it is widespread, is it not?
Mm-hmm. Yes, first of all, I will, sometimes it's confusing for people. What is really diabetes? I will say it's a metabolic or endocrinological disorder, which is causing elevated blood sugar due to either complete insulin deficiency, insulin resistance, and leading to different complications. When you say, and again, we broadly divide the diabetes depending on the level of the insulin in the body. One is type 1 diabetes. People come across that term quite often, and type 2 diabetes. I will stress more on the type 2 diabetes since I'm adult internal medicine doctor, and it is 90% of the diabetes all across United States.
Because that was going to be my next question,
Yes.
which is the more common. So type 2 diabetes is the more common
Yes.
type of diabetes.
And
So,
yes.
if it runs in the family, does it increase someone's chances of developing diabetes?
Unfortunately, the question is yes.
Mm.
It does increase the chance, and the studies have shown it increases 5 to times higher risk of having the diabetes if someone has a family member having diabetes.
Yeah, and so I think a lot of us as Americans, though, and maybe around the world, maybe you're more experienced in that, but I will say that sometimes we ignore that. We see a lot of problems in our family, but we're like, we throw caution to the wind, and we don't pay attention to that.
And for that, American Diabetic Association, or ADA, has set up certain criteria, and this, which called a diabetic screening test. We recommend every person 45 years of age and screening every 3 years. But again, since it's so widely spreading, it's kind of metabolic syndrome associated with obesity, we have defined certain risk factors. And if any one of you and people around you have those risk factors, please go ahead, talk to your primary care doctor or your family physician to get you checked for the diabetes.
Yeah, and if you would love to join the Lake Health family, or you need more questions answered, 1-800-454-9800. That's the Best of Health line. And whether you want to meet with Dr. Syed or anybody that has worked with the diabetes field, you have questions. There's so many questions. That's a scary term, Kat. It's a very scary term.